Good morning. Today video is gonna be about blood glucose monitoring and insulin administration. The first part of the video I'm gonna do blood glucose monitoring. So I'm gonna verify my order from the physician with MAR, and I'm gonna identify my patient by their last name and the date of birth, Jan 1998. Since this is my correct patient, I'm gonna do hand hygiene and I'm gonna put on some clean gloves. I'm gonna ask my patient to wash their hand and dry their hands completely. While my patient does that, I'm gonna turn on my blood glucose meter. I'm gonna place a strip on the meter. Since my patient has washed his hand and his hands are dry completely, I'm gonna take a alcohol swab and clean the site. The site is gonna be the lateral aspect of distal end of his index finger. I'm gonna clean it in a circular motion and I'm gonna let it dry. When it's completely dry, I will prick the patient 1, 2, 3. Now I will discard the first blood that I got from the prick, and now I will squeeze his finger a little bit to get more blood, and then I take that blood and put it on the strip. I'll make sure that the blood has wicked the strip, and I got a reading on my monitor. The reading is 252 mg per dl. Now I will turn off my meter and I will disinfect my meter. I'll remove my gloves, do hand hygiene, and I'll tell my patient that his blood glucose level was 252 mg per dl, and I will document the procedure. Now the second part of the video is going to be insulin administration. The first thing I'm going to do is I'm going to verify the order, and then I'm going to identify my patient by their last name and the date of birth, January 1998. Since this is my correct patient, I'm going to do hand hygiene. I'm going to put on some clean gloves and do focus assessment on my patient. The patient blood glucose level was 252 mg per dl. Patient has signs of hyperglycemia. Patient has polydipsia, dry mouth, polyurination, has fruity smell of breath. And if the patient was hypoglycemic, the patient will have shakiness, chills, tingling sensation in his lips, in his tongue. In severe cases, patient might have seizures and can lead to coma. The patient states that he wants to eat in 30 minutes, and the previous injection site for the patient was upper outer of left arm, and today we are gonna administer insulin in his abdomen. The skin on his abdomen looks intact. There is no redness or swelling. So now I'm gonna take my insulin vial, regular insulin and NPH insulin, and compare it to the MAR to make sure I got the correct medication. I'm gonna check the expiration date and I'm gonna roll the vial. Now I'm gonna clean the top of the vial with a clean alcohol swab in a circular motion. Now since the NPH insulin is 16 units and the regular is 6 units, the total of insulin that I'm gonna give today is 22. I'll aspirate 16 units of air in this syringe, and I'll inject that into the NPH insulin vial without touching the top of the solution. Now I'm gonna aspirate 6 units of air and inject it inside the regular insulin vial without touching the top of the solution. Now I'm gonna draw 6 units of regular insulin. I'll make sure I got the correct dose and I'll get rid of the air bubbles. Now I'm aspirate 16 units of NPH insulin, and the total inside of this syringe should be 22. Now I'll recap the needle so I don't prick myself. I'll make sure I got the correct dose, 22, and I got rid of the air bubbles. So now if I was outside my patient room, I have to label this syringe, but since I'm here with the patient, I'll do my third accuracy check on the bedside, and I'll verify the insulin dose that this is 22 units with another nurse. And when it's verified, then I'm going to explain the procedure to my patient. Good morning, Ms. Doe. This is your insulin, and your blood glucose level was 252 this morning, and I'll give this insulin to bring your blood glucose level down so you could eat afterwards. So now I'm gonna clean the site in a circular motion, which is gonna be her abdomen. Let it dry, and I will take my insulin and I'll pinch 2 inch of the patient's skin and administer the insulin in 90-degree. If it was 1 inch of skin, then I have to administer insulin in 45-degree. I pinch 2 inch of skin and 1, 2, 3. I'll administer insulin slowly. Now I will discard this syringe in a biohazard bin without capping it, and I'll place another alcohol swab on the side for a few seconds. Now I will remove my gloves, do hand hygiene, and I will document the medication that I gave, the route that I gave, the time that I gave that medication, the dose that I gave, and how the patient responded to the procedure and the patient response to the insulin. And I want to state there are 6 rights of medication. The first one is right patient, right medication, right time, right route, right dose, and right documentation. Thank you.